Hello and welcome to Pharmacy Skills. In this video we'll look at blood pressure and hypertension. What is hypertension? Well, first of all, hypertension is a treatable cause of many cardiovascular complications. We can simply define it as a persistently elevated blood pressure. That means blood pressure that is consistently high. Hypertension is a major risk factor for conditions like myocardial infarction, stroke, heart failure, chronic kidney disease, and even sudden death. So hypertension is more prevalent in certain patient groups, including elderly people, women, Afro-Caribbean people, but there are also other several risk factors that can influence the chances of you getting high blood pressure. This includes a family history of high blood pressure, your diet, that would be things like the cholesterol in your diet, and simply your lifestyle, like how much exercise you get in during your week. The aim, however, for treatment is simply to prevent all these secondary cardiovascular events and to reduce the mortality and morbidity. And this is achieved simply by lowering the blood pressure. So before we go into drug treatments, we'll look at non-drug treatments. This includes giving the patient some lifestyle advice, telling them to exercise, telling them to eat a healthier, more balanced diet, and also avoiding excessive salt in the diet or avoiding excessive alcohol intake and even reducing the level of caffeine if they have to. Now let's look at hypertension thresholds. These are the blood pressure readings in millimeters of mercury that allow us to diagnose a patient as either stage 1, stage 2 or severe hypertensive. So the guidelines here are in line with NICE guidelines, and I will simply highlight the differences that are shown in the SIGN guidelines. Anyone with a clinical blood pressure of 140/90 and above should be offered ambulatory blood pressure monitoring or home monitoring to make sure that it's not just in the clinical setting, to make sure that the blood pressure is consistently high. Stage 1 hypertension would be a patient who comes in and they have a blood pressure of 140/90 to 160/100. And then if they have the ambulatory blood pressure monitoring and it comes back as at least 135/85, then we can diagnose the patient as having stage 1 hypertension. Now what we'll do at this point will vary depending on the age of the patient. If they're under 40, we have to refer them for further investigation because it could be secondary reasons as to why they have hypertension. If the patient is between 40 and 80, then we'll do one of two things. We'll give them lifestyle advice regardless. However, it would treat the patient if they have any type of targeted organ damage or if the 10-year risk of cardiovascular disease is greater than 10%. And we'll look at some of the ways to measure cardiovascular risk in other videos. Also, if the patient has chronic kidney disease or retinopathy, then we'll offer them some kind of treatment. If the patient is above the age of 80 and is stage 1 hypertensive, then we'll also obviously give them lifestyle advice, but then we'll treat them if the blood pressure is 150/90 or above. SIGN guidelines slightly differ to the NICE guidelines in that you would treat all cardiovascular patients with a blood pressure of 140/90 and above, and you would even treat normal tensive patients if they have a history of any transient ischemic event. Alright, let's look at stage 2. So for stage 2 is when a patient comes in and they have a clinical blood pressure of 160/100 to 180/120. And if the ambulatory blood pressure monitoring comes back as 150/95, then the patient can be diagnosed as stage 2 hypertensive. In this group of patients, we treat all patients regardless of whether they have organ damage or not. The last group of patients are those who come in a clinical setting and have a blood pressure reading of 180/120 and above. For these patients, we don't waste any time. It's a same-day referral to a specialist. The specialist will then assess if the patient has organ damage. If the patient does not, then the specialist may suggest to have the test redone again in 7 days. If there is any sign of any organ damage, then the specialist will go ahead and treat the patient. So those are the thresholds. Another key thing that we need to be able to do is assess the cardiovascular risk. All patients with hypertension need to be assessed for the risk of cardiovascular disease or the secondary adverse events that come from having high blood pressure. We'll look at the patient profile for things like glycated hemoglobin, for the electrolyte, for creatinine, estimated glomerular filtration rate to assess their kidney function. Also, we'll look at their cholesterol, specifically the high density lipoproteins. We may also look at proteinuria and hematuria, and also hypertensive retinopathy, and we may even do an ECG. Now, it's important just to make a note here that before the patient has had any adverse cardiovascular events, We wouldn't offer them aspirin. Aspirin is reserved for secondary prevention after they've had some kind of an adverse cardiovascular event. So now that we've looked at the thresholds and the need for assessment and the kind of things we'd assess, let's look at some of the hypertension targets. Now, the hypertension targets are goals or blood pressure readings when we want to get the patient to reach. Obviously, this will differ depending on the patient's age and also the patient group. This is just simply because of the different physiology in the different patient groups. We'll look at patients under the age of 80 first. Those under the age of 80 should aim for a clinical blood pressure reading of a maximum of 140/90 and an ambulatory blood pressure reading of 135/85. Now, for those over 80 who struggle more to bring down the blood pressure, the clinical target is slightly higher. So we want to aim for a maximum of about 150/90 and an ambulatory blood pressure reading of 145/85. Now, I'll just point out here that the SIGN guidelines slightly differ in that you want to aim for a blood pressure of 140/90 regardless of age. Pregnant women should aim for a blood pressure of 135/85, and we'll discuss in the next few videos why exactly some pregnant women tend to have a higher blood pressure. Patients with renal disease should aim for a blood pressure reading of about 140/90. Patients with renal disease and diabetes should have an even lower target for blood pressure, and that should be around 130/80, as they're at risk, serious risk of more adverse cardiovascular events. The last group is patients with type 1 diabetes mellitus. These patients should aim for a reading of 135/85. However, if a patient with type 1 diabetes mellitus also has some kind of a metabolic syndrome, then we'll aim for a slightly lower blood pressure reading. We'll aim for 130/80. Okay, so that's the introduction to hypertension. Next, we'll look at the treatment for high blood pressure. See you guys in the next video.